The abdominal area is located right here and can be very painful. Symptoms are things that you can feel when having abdominal pain. Here are some symptoms of abdominal pain: nausea and vomiting. You feel bloated and full of gas. You have diarrhea. You develop a fever. You have problems going to the bathroom, either going very, very often or having pain or bleeding while you're having a bowel movement. Your pain may be severe or very mild and not hard at all to tolerate. There are many possible reasons why you have pain in your abdomen, and they may not seem to cause any danger to you. Here are some of them. You may have a virus, like a stomach flu, with vomiting and diarrhea. You may have eaten too much. You may have a lot of stomach gas. You might have food poisoning. Food poisoning might be from not cooking some foods long enough and you ate it anyway. Or there may be something rotten in the food itself and you ate it. And then you become sick very suddenly. You may be constipated and can't have a bowel movement for a while. You may be pregnant, but you don't know it, and you wonder why you have pain. Sometimes there can be serious reasons why you have abdominal pain. And here are some of those. You could have either a kidney or a bladder infection. That's also called a UTI. The problem could be your gallbladder. That's located right underneath the liver. The gallbladder can become swollen and red, and it hurts a lot. You could have problems with your appendix. Sometimes appendix is abbreviated to AP. The appendix is a small finger-like structure that's down near the bottom of your intestines on the right side, and it can become swollen and painful. After you've returned home from the ER, how do you take care of yourself? First, make an appointment to see your family doctor, your PCP, and before that appointment, write down or try to remember a list of the following things to tell the doctor. How often the pain occurs, why the pain occurs, where the pain is located. If the pain strikes suddenly, and if the pain builds and builds, becoming worse and worse. Be ready to give all of this information to the doctor at your appointment. The second thing to do when you're at home is to rest. Just stay in bed and rest. Drink 8 to 10 glasses of water every day. Take any medications the doctor prescribed or told you to buy over the counter. Follow the instructions exactly. This will help reduce the pain and bloating. One medicine you may take is Advil. If too much acid and gas is causing your problem, you can take Maalox. Maalox is a white liquid medicine that you drink. Additionally, Pepcid is a pill you take, which will help the acid to dissolve. If your abdominal pain or cramping is caused by an infection of some kind, antibiotics may be prescribed. Your eating habits may have to change. If you like to eat constantly, all day long, you'll need to eat smaller meals. You may need to avoid greasy meals, such as fried foods, fast food, like hamburgers, French fries, chicken wings. All of those are off limits now. See your doctor if your pain does not improve over the next 2 or 3 days, if you have excessive diarrhea, if you're not using the bathroom as often, if you have any other questions you need the doctor to answer. Go back to the ER if any of these things occur. If your pain continues and you cannot tolerate it, if you develop a fever over 101 degrees Fahrenheit, if you start to have problems breathing, if you vomit and you see blood in it, if your skin color looks yellow, if you have a bowel movement that looks black, if you feel dizzy, any of these symptoms are reasons for you to go back to the ER.